Good morning, good afternoon, good evening to all of our guests from all over the world. We've been coming through a remarkable period, a really astounding tragedy around the world. And our concerted efforts together are making all the difference in how our communities and our cities and our countries are able to reopen and regain human contact that we so much crave. Every workplace is undergoing repeated testing. Every university, every traveler recognizes that testing for coronavirus is critically important to our ability to interact safely together and to overcome this pandemic. So it's really exciting today to offer this opportunity for you to discuss those technologies that are helping to safely reopen the world. And we have two wonderful speakers with us today, two stellar Imperial alumni, Dr. Winston Wong Jr. and Professor Pantelis, Georgiou. First, let me tell you a little bit about Imperial College London. We are one of the world's greatest universities, focusing on science, engineering, medicine, and business. We have about 20,000 students and 8,000 staff pursuing the forefront of research, education, and innovation. One of the greatest measures of our success is through the incredible accomplishments of our students, staff, and alumni. We have over 200,000 alumni worldwide. So it is my distinct pleasure to have two illustrious alumni joining us, one who leads an impressive biomedical diagnostics company, and another who is one of our star academics. Dr. Winston Wong Jr. graduated from Imperial with his PhD in electrical and electronic engineering in 2010. Winston is the founder, chairman, and managing director of Credo Diagnostics Biomedical. Focusing on research and development of revolutionary diagnostic technologies since 2011, Credo Diagnostic Biomedical develops, manufactures, and commercializes innovative, cost-effective, and rapid molecular diagnostic solutions at the point of care in the area of human infectious diseases, animal health, and human wellness. Joining him is Professor Pantelis Georgiou, who graduated from Imperial with first-class honors Master's of Engineering degree in Electrical and Electronic Engineering in 2004, and his PhD in 2008. Pantelis currently holds the position of professor at Imperial College London within the Department of Electrical and Electronic Engineering. He is the head of the Bio-Inspired Metabolic Technology Laboratory in the Center for Bio-Inspired Technology, a multidisciplinary group that invents, develops, demonstrates advanced micro devices to meet global challenges in biomedical science and healthcare. Pantelis and Winston, it's wonderful to have you here with us today. And our students, staff, alumni, and friends are looking forward to hearing from you today. So let me start. You were both working in diagnostic testing before the pandemic. We'd love to hear about your technologies. You had to shift your attention to this urgent situation where testing has become absolutely critical to our future. Let me start with you, Pantelis. What were you working on before you first heard of COVID-19? And what did you think when you first heard of COVID? And when did you realize it was serious?
Thank you very much, President Gast, and thank you everybody for listening to our discussion today. It's an honor to be amongst you. I want to start by portraying our research journey in terms of the technology that we developed here at Imperial College. And it all started probably about 5 years ago. I mean, with a background as an electronic engineer, we were very familiar with designing lots of medical device and healthcare technologies. But the vision was always, can we bring the sophistication of a microbiology lab to something that you can carry around in the palm of your hand? And that was the vision. We had advanced a lab on a chip technology using semiconductor technology, microchips. And with that, we made a very small disposable cartridge like this one here, which has an array of thousands of chemical sensors. And on that, with compartmentalization, microfluidics, we can detect with high sensitivity and specificity DNA and RNA incredibly rapidly. We then repurpose that to make what you see here. It's a handheld molecular diagnostic, which provides an end-to-end solution, sample to result very rapidly in under half an hour. And it's got connectivity to the cloud for real-time epidemiology and surveillance. Our focus before the pandemic was always looking towards low middle-income countries, where there's a huge need for diagnostics. Due to mosquito-borne infections, such as malaria and dengue, there's a huge burden to the healthcare system in those countries. Also, if you think about rural health, they don't have access to big community hospitals or sophisticated labs. So having a portable molecular diagnostic like this, which can tell you with incredible accuracy what the infection is, can be life-changing, because we know things like malaria and dengue can cause fatalities, and they're quite severe infections, which overburden the healthcare systems. So that's always been the vision, targeting low middle-income countries, but also closer to home. We've been combating what's called antimicrobial resistance. It's a huge problem. We know due to the resistance in bacteria through overuse of antibiotics, the forecast is by 2050, antibiotics will stop working and will cause 10 million deaths. And locally, with our collaborators in the Imperial NHS Trust, we've been looking to fight this by creating, again, rapid diagnostics, which identify what your bacterial infection is, also the resistant strain, so that then you can then give targeted antibiotic therapy and drive down resistance. So that's what we were doing. In terms of our journey leading up to the pandemic, I'm going to start with the summer of 2019, where the team actually went to Ghana and we did a real-life test of this technology showing its portability on malaria. And our intention was always to go back in the summer of 2020 to run it then in the boot of a car and drive around to the rural areas of Ghana and test it in children in schools. That obviously has been put on hold due to the pandemic, but it gave us belief that the technology is portable, and it detected malaria in that instance with incredibly high sensitivity specificity, and then under 15 minutes in terms of the parasite. Moving forward now to November 2018, closer to home here in the UK, we had an outbreak of colistin resistance within our NHS, the so-called MCR9 colistin resistant gene. And again, we were called upon to make a rapid diagnostic, and we there demonstrated the versatility of the technology, because within 3 weeks, we developed the assays to identify the target, and we rolled out the diagnostic showing an average detection in under 10 minutes. It's important to note this is a molecular diagnostic test. It's an isothermal amplification technique, which in real time can amplify the DNA and give you a time series data as well. So you've got incredibly rich information there, which allows you to do all sorts of things in terms of predicting with confidence that your result is positive, but also it allows us to multiplex quite reliably. Now moving forward to March 2020, I mean, the pandemic was declared globally earlier than that, but here in the UK, it's vividly in my mind that, because it was closer to Mother's Day, it's when we were waiting to take my son to nursery to celebrate Mother's Day at an Imperial College nursery, but then the pandemic happened and the whole of London and the UK and Imperial College South Kensington campus shut down. At that point, I mean, we'd already been discussing with the team, we can actually do something for this pandemic. We can repurpose the diagnostic quite easily to detect SARS-CoV-2. And at that point, although the whole college shut down, we got special permission from President Gast to be assigned as key workers and keep our lab going in South Ken. It was one of the only labs going. And credit goes to the entire team. We all came together with a collective mission. Let's create a handheld molecular test with equivalent performance to a PCR, which can detect SARS-CoV-2 in under 20 minutes. We obviously had access to the wealth of expertise through our Imperial College NHS Trust and inactivated samples coming through our local microbiology at Charing Cross. And with that, we could do our validation. And we showed that we could detect it with incredibly high sensitivity and specificity, over 90%. Which was a success in our mind. And in parallel to that, with our ongoing enterprise division at Imperial helping us with the translation, we then set on a path to say, okay, the technology works pretty well. How can we now translate it? So we founded a company, ProtonDX, and our mission since then has been to set up production and try and manufacture this thing at scale so that we can deploy it for detection of respiratory infection in the first instance, but not forgetting about all the other infectious diseases that we've been working on, because even though COVID has just arrived, there was infectious diseases before COVID, and there will be infectious diseases after COVID.
Thank you. What an incredible time it has been. And I do give all, compliment you and your team and everyone who's been working so hard over these past couple of years, and it's making such a difference. Winston, you graduated and founded a company right away, and then you found yourself in the eye of the storm too, but you had your spin-out company. Can you tell us what you were doing, how your technology works, what you were doing before you heard about COVID, and then how it changed what you were doing?
Yes, thank you, President Gast. I'm very happy and delighted to be here. So I think Dr. Pantelis, Georgiou summarized how the importance of diagnostics. Point of care molecular tests are very important. So I think point of care means that you want the accuracy of a lab and quick turnaround time, less than 30 minutes. And I think very crucially, it's very important that it should be affordable. So I started my company in 2011 and have been doing R&D since then. And then we actually launched our second platform called Vita PCR right here in 2019 September in United States at the AECC event. The device is at that time was focusing on upper respiratory diseases, and sadly in January 2020, I heard an outbreak of the COVID virus and told the team that doesn't matter how long this pandemic will be, I think we have the responsibility to contribute to fight this pandemic. So we added the COVID-19 to our product menu, and we from development to rolling out the product, it took us 6 weeks, and in March we were able to deliver to our distributors.
Well, that must have been an incredible speed to get that done so quickly, and then how the demand must have been huge, and how did you scale up so rapidly, going from hundreds to hundreds of thousands? An R&D lab isn't equipped to distribute numbers.
Yes. I mean, 2020 took us, a surprise. It's a surprise for us, and we all know that, having a prototype is one thing, product development is one thing, and then scaling up is it's very, very challenging when you want to keep the QC and the cost there. So initially, before we launch our product, our goal was to produce around 1 to 2 million tests a year. But in 2020, the demand was so high that it took us 3 to 4 months to produce 1 million tests per month. And now we are meeting the demand. Maybe we are doing 3 to 4 million tests per month, but the demand is still growing since the Delta virus. Yeah.
So you guys are both wonderfully trained electrical engineers, scientists. You understand all of this. You developed these exciting new technologies. We've all experienced shortages of materials throughout the pandemic and bottlenecks in trying to do anything. I'm wondering what your challenges were as you were growing this, trying to fulfill the need.
Actually, the shortage of supply continues to today. In 2020, every consumable part had encountered a sudden shock in demand, and coupled with the fact that almost every country in the world had depended on supplies from China, and the government had imposed a national lockdown. But it was a very good experience for us to learn to source worldwide. But of course, we need to bear with the premium cost. Yeah.
So Pantelis has his work. He's working with the NHS. Where are your devices, and who are your biggest clients right now, Winston?
So we actually sell to more than 30 countries in the world, mostly in Europe and Middle East, Mongolia, and this year we are looking into Korea and United States, and of course, we we are looking worldwide market, but the challenge will be the certification. Certification is time consuming. Yes.
So how does that work? You've applied for certification and do clinical trials?
Yes. So now we obtained the CE mark first, so that's why we were able to sell in Europe, and also every country has different certification. Europe and Mongolia and South America, Malaysia, Korea, Japan, so on and so on. But I think the biggest challenge will be the FDA, and FDA was overwhelmed with the application last year, and they had to set their bar higher and higher. And we are actually still working with them, and hopefully we should obtain FDA in the next few months.
Great. Pantelis, this whole experience has probably accelerated your entrepreneurial work, I would imagine, and I wonder how you've been, viewing your research and your entrepreneurial work and the upcoming market need and the technological development. You were already doing this on antimicrobial resistance, a huge challenge for us in the future, malaria, other diseases. How are you, did your research program change, and your view on listening to what Winston's gone through, also your view on the spin-out company?
I mean, it's been quite a journey, I have to say, because as you can appreciate, making prototypes in the lab, tens of prototypes is different to trying to manufacture things on the thousands. But also we have to bear in mind, you can make a great technology, but to make a great product also has many other requirements. So ease of use has to be high on the agenda. It has to be robust, and it has to perform exceptionally well. So putting all those in the mix has, I could almost say, made us rethink the way we design things as well, because obviously thinking about where it's going to get deployed and what the pressures are there, also considering cost, makes you then think about alternative paths as to how you can develop your technology. And that's been a great experience for me as well. And it's all fed back into the lab as to how we can design and scale these things. In addition to that, we've come to realize what the great potential is of our technology, because obviously with the COVID-19 pandemic, there's been lots of diagnostic companies come to fruition, all with different advantages as well, and doing a great job. Whereas we knew that our technology was incredibly scalable and multiplex, for example. So from the beginning, we said, okay, let's go for a full panel, including flu, rhinovirus, and influenza. But also thinking about more ambitiously in terms of our research programs, we could start to dream of a world where you could deploy what we call a febrile chip, a fever chip. You come in with an infection, because you've got that multiplexing capability, you could quite reliably diagnose what the infection is. And it can even answer a very simple question, for example, is your infection bacterial or viral? An answer to which, it's a very simple question, but the answer has huge implications, because in the first instance, not to give antibiotics. And secondly, it sets you down a path where you can do further quantitative analysis to see what the infection is. Because also during the pandemic, we've seen unknown strains of secondary complications due to the virus as well, which also require diagnostics.
Yes, that's really an important point with the antimicrobial resistance, is trying to take an antibiotic for everything, whether it's appropriate or not. And this desire to treat symptoms, we treat symptoms if we don't know what it is. So the rapid diagnosis that both of you are working on is going to be incredibly important for so many things. It really strikes me that, again, you're great scientists, and there must have been quite a bit to learn, a steep learning curve. You mentioned all these different countries, Winston, from Mongolia to the United States.
Yes.
And how you understand things like labor or tax laws or health regulations, or how have your experiences developed in this direction, and how should we at Imperial are very much supporting our entrepreneurs, as you know. We have Scale Space in White City, we have the incubator, the iHub, we have venture mentoring, we have student entrepreneurial contests and mentoring. how do you learn all these things, and what should we be adding to, and what do you need to know when you're going to jump off and start doing this at scale?
Well, thank you, Alice. I think as an entrepreneur, you have to learn everything, especially your startup, right? So I would say what you learn from school are the basics, and there's so much to learn. You have to learn about everything when you start your own company. So from where you're going to base your company, how you're going to structure the company, you have to learn about HR, management, finance, everything. But you will learn along the way, and I think PhD is a great training that gives you the ability and capability to learn things quickly, and I'm very fortunate to have that. And but as for myself, coming from a electrical engineering background, there's a lot of bio to learn. So this 10 years I've been working hard to learn my biologies, and molecular biologies as well.
Yes, well, an excellent education is really important, and it, if anything, it teaches you to question and to keep on learning, and clearly that's critically important. You must have a lot to understand with regard to validation and certification in different countries and what you have to go through in different places. You also can build a team, and finding those talented individuals to bring into your team is another skill to acquire. Perhaps in a great and vibrant postgraduate education program, you learn a bit of that. There is a question in the chat about your work, Winston. Can you tell us more about your work at Charles de Gaulle Airport, and how did it impact the experience of people flying in and out of this airport?
Okay, so we are we actually promote airports all around the world to use our product, because we believe that you should screen everyone coming in, especially many countries are doing that: Singapore, Hong Kong, China. And I think starting at the CDG is a very, very, very good place to start. But they implemented our device only when there's the passenger has symptoms. Passenger have symptoms, then they do a screening for them. But I think in the future, it should be before you board a plane, you should do a test, on the spot, and then when you land, you can do a test on the spot. I think that should keep our borders safe.
Yes, I would say, having just recently traveled, I saw a post at Heathrow, and I think you can, if you haven't been able to acquire your test, you can get it at the airport. But we're paying quite a bit for these tests, and I think part of both of your goals, Pantelis was talking about serving lower income countries, is to make these tests less expensive. Currently, I guess it's market driven, not technology driven, but maybe you have some thoughts on that.
Yeah, I believe that the test, like I mentioned, the test should be affordable. I think it's everyone's right to be able to use it, and that's why I think I just before the Q&A, I was talking to Dr. Pantelis that I think from the ground up, when you design your product, you have to keep that in mind. How you're going to lower the cost in terms of not only materials but also production as well. So that's very, very important, and that's what Credo has been doing. We started from that mindset, and this is a lot of companies, they have a diagnostic test with a cartridge, like CFIT, like Abbott, like Roche. They have cartridges, and cartridges and microfluidics, they're not that the cost wise not that low. But what we have here is all we have here is just a simple tube, and then we lyophilize reagent inside and everything in-house. And this is how we bring down the cost. And then hopefully this can be used around the world for especially third world countries as well.
Pantelis, would you like to comment on that? And then there's a question to you from Hassan Algaband with whether your test kits are marketed already, and if so, under what brand?
Okay, so totally agree. Cost has been at the driver of the technology as well. We have to drive down costs to make them deployable, especially when we're talking about low middle income countries or settings where you want to deploy hundreds of tests. In terms of cartridge-based tests, one of the big advantages I can say is ease of use. You can put the sample in and then you need to forget about it because you have to consider, the people running the tests as well. What's your throughput in terms of number of tests per hour, and so on and so forth. I mean, we're lucky in that most of our parts of our cartridge are either from the consumer electronics industry, so already there's been trillions of pounds of investments to bring the costs down, or from the plastics industry as well, where you can manufacture and machine these things at incredibly low cost. And in fact, the actual bill of materials, the highest cost piece is the assembly of all the parts, and that's where clever engineering comes into play as well. So you can assemble these on a production line and drive down the costs. So that's been another learning experience for us, but we're confident in terms of our price point. We're definitely going to bring it down to be something comparable to what you see in terms of the antigen tests. In terms of the question about marketing our product, as I said, we've just spun out the company officially in December of 2020. We've set up manufacturing. We're looking to get certification by the end of this year and officially launch Q1 next year. And if anybody wants to follow up or learn about the technology, they can either visit our website on ProtonDX or they can email me directly.
Thank you. I think one of the aspects of a discussion like this is to have people understand how this is going on and what you're working on. I think that for both of you, we're really work hard, and I think I'd like to get your thoughts on advice for universities and venture capitalists and governments. We're trying to bridge that valley of death. So you have a good technology, as you said, you've discovered and you've worked on, and then you need to take it out to market. And there are many hurdles and many challenges there. I guess, it would be good to hear from both of you what your advice to us as universities, but others out there, venture capitalists, governments, and others that would be helpful when developing a company such as yours.
So Pantelis, I'll start. I'm very grateful to Imperial College. Actually, the education there, it gave me a very all-rounded education, and actually, the most valuable thing is that it opened my vision in various industries. And so I started my company after I graduated from Imperial, and I believe that when you start a company, to be an entrepreneur, you have to have a core vision. And then my core vision was that I want to make advanced medical tech affordable and accessible to all. So that was my passion when I studied with I studied with Professor Tumazu, and so I saw the needs of the medical testing, point of care medical testing, and I believe that it should be decentralized. What I meant by that is nowadays you do have to send the samples to the labs. Most of the countries are like that, and I believe that the test should be implemented in clinics, in pharmacies, and eventually at home. So my advice to people who want to start their own career or own company is that you have to have a very strong belief of what you're going to do, and you have to be persistent. It's really tough, and medical industry is really tough. You want to go into the medical industry, like Pantelis said, that from the very initial design of the product. You have to think about all the aspects, not only the material, but also you need to think about the manufacture. You need to think about usability. You know, you have to be easy to use if you want to do it at the point of care. It has to be, you know, affordable, and also most importantly, you have to be able to fulfill all the regulations. That's very tough. So do your work and before you start everything, and be cautious, I would say. Yes.
But I guess universities can help with that in as much as we allow students to start being more entrepreneurial, and even if their first idea isn't the one they ultimately stick with, they learn a lot from mentors. We have a venture mentoring service where serial entrepreneurs can come give their advice to our entrepreneurs. So I think that it's an important time when we can make a big difference in this. Pantelis, what is your perspective, please?
So I mean, first I have to talk about Imperial College, not just because I'm academic here, but they've set up a great ecosystem for entrepreneurship through Imperial Enterprise, which definitely helped us during our journey. There's various schemes which I can get my PhD students enrolled in, such as the Accelerator or the MedTech Superconnector. And that helped us start to shape our thinking towards commercialization. We've got support in putting together business plans and so on and so forth. But also it's been good for them as well, because they've learned from us as we're spinning out, and we're learning from them. So they've actively sought my feedback in terms of what we can do to improve the process, because there was a steep learning curve for us. Coming out from academia into the world of business isn't a straightforward task, and there's lots you need to learn about. And also you need that support in terms of business, because as academics, you know, we're very good at writing grants, writing papers, doing the research, but then putting together a business plan, conducting a business pitch, thinking about your profit and loss or your sales forecasts. You know, all these are new notions which are common in the business world, not in the academic world, but Imperial does a fantastic job at providing the support to bridge those two. So in terms of advice for universities, my advice is, you know, look at our schemes. I mean, there's others as well. For venture capitalists, I mean, my word of advice is, you know, be patient. I mean, from their perspective, it's always about when is the product going to be ready, but they need to appreciate that the development of a product is a sum of many moving parts and people all coming together. And that's something that we portrayed from the get-go. You know, there's no shortcuts to success. It all needs to be planned properly. And, you know, you need to release a product which is credible of the, you know, the organization where it comes from, but also the underpinning research which you've been doing throughout the years. And my final advice for governments, I would say, I mean, we're seeing it as of recent, you know, all our undergraduates, also people in this world, you know, they're very tech savvy. They've become very entrepreneurial. You know, in the past, it was all about Silicon Valley, but I think now the Silicon Valley notion has kind of become global, and I'm seeing it in all our undergraduates as well. Everybody who comes into my office, like, okay, what are you going to do after you graduate? I'm going to start a company and do this. So at least the governments need to facilitate that. So when they finish, you know, there needs to be opportunities, internships, funding opportunities. I mean, we've just been through an economic crisis here in the UK. We've also been through Brexit. We know funding is scarce, but we've got a population here geared up for innovation, and we need to fuel that, and which will ultimately fuel an innovation economy. And there's been lots of successes globally in different countries. I mean, Winston's in Singapore. You know, Singapore's innovation economies is amazing. You know, so we could take example from that, for example, and bring it home so that you know, we can do some great tech.
Absolutely, Pantelis, that's very aligned with one of my big messages, that we need research, teaching, and innovation to be coupled together, and you can't do them in isolation, because it is the students and the graduates who are our best tech transfer. And you both epitomize that as some of the best outputs we have. I have a question from Yazid to you, Pantelis, saying academics need to publish detailing their models, assumptions, and results. How do you reconcile business needs to protect your proprietary research in your entrepreneurship ventures with the demand for full transparency in journal publications.
So at this point, I guess I can pay homage to my mentor, Chris Tumazu, who also received this information from the great and the late Sir Eric Ashe that said, publish or perish. Sorry, patent or perish as well. So whenever we're coming up with an idea, we've got support through Imperial to file invention disclosures immediately before publishing. We have a very rapid discussion about the innovation, and with a quick turnaround, we can deem if it's patentable. And through that mechanism, it allows us to protect any IP before we send it for publication. Again, looking back and reflecting on this journey of entrepreneurship, that's something also that's been engraved in my mindset. You know, if you're making a technology, you might see a great opportunity or a market pull. Before sending it out for publication, it's worth just flagging it up with Enterprise to file some IP on that, because you never know, you know, what it might lead to. And obviously the whole startup scene is geared by patents. With Imperial, we've got a great mechanism where they get licensed into the new code, and we can use that then for further business ventures as well.
That's great. And I'd like to, you mentioned students coming in wanting to be entrepreneurs. And I know we've seen this, MIT has some data on the fraction of students going into venture-backed companies when they graduate has grown tremendously. And I'd like to ask both of you about that. You know, Pantelis, from your perspective, on the students wanting to become entrepreneurs, and do they want to work with your company or others? And Winston, where you look for talent. You've been out of Imperial for a few years, and how you hire and where you look for talent. So Pantelis, perhaps that talent pipeline and student pipeline.
Yeah, I mean, we're fortunate at Imperial College to have some of the best students in the world. And as I said, they've really got this buzz of innovation. We see it year on year. There's open opportunities for internships in the company as well. But also through our undergraduate scheme, we've got a great opportunity where it's almost like a group project where we turn them into technical consultants, and they invite companies to come to them with problems and come up with solutions. We also send off our students into industry for 6 months as well, so that they can get groomed into the industrial way of thinking. And all these, they just contribute to their education in terms of technology translation and entrepreneurial education, which, you know, we're hoping that after they graduate our departments, you know, they'll go on to start their own companies, you know, go on the research journey to translate technologies, you know, realize their ideas and innovations, because they do have fantastic ideas. I mean, we see it year on year through our undergraduate projects, and also the ones which come through to PhDs.
Well, and you can see that from your younger academic sibling, Winston, who graduated before you from the same research group. Winston,
Yes.
where are you looking?
Yeah. So I think, you know, starting your own company and joining a startup is two different stories. So for use myself as an example, that I actually started in Singapore, and I mean, Singapore is a fantastic place to start your company. But you know, it's also you get a lot of talents, you know, from A stars, and you have to praise the government to bring a lot of talents into Singapore. But you know, like Pantelis said, research R&D is you have to be patient. It's a really long process, especially you start from zero. I started from zero, so I had to move my my company to Taiwan, where the cost is lower, and actually Taiwan also has great talents as well, and in the mind, you know, of production in the future, I think Taiwan is also a great place, a testing ground to start productions. And so that's how I started. So starting a company, the sustainability is very important. Resource is scarce, you know, money is finite. So you have to make every move. You know, you have to think thoroughly and make every move very carefully. So, but now because the success in Taiwan, we're bringing back our because we were able to automate the production process. So we are bringing the factory back to Singapore, and that's why I'm in Singapore to recruit talents. If any Singaporean alumni are listening to this, we're happy to interview, and we were recruiting and quickly, rapidly, and we want to build a factory here as well.
Great. Thank you. One of our court members, Dominique Klein, asks how our speakers feel about the potential to create sustainable businesses that will become a national pride. And is this something they've considered for their businesses? It's interesting, as you have to find the best place to launch and to go, and you need the capital, you need the talent, you need the places, and maybe both of you could talk a little bit about that.
Would you like me to go first?
Sure. Yeah, please go ahead. Yeah.
So when we spun out the company, we immediately started engaging with DHSC, Department of Health and Social Care, and they also relayed to us, at the top of the government's agenda was contribution to local economy. So at that point, everything that we did towards manufacturing, we tried to keep local in the UK. And we're hoping that that's going to then, help set up manufacturing and everything here locally, so that we can really, as you said, contribute to our local economy, but also raise up the flag of national pride for the UK.
So I'm a Singaporean, so we are a Singapore company, and we although we started in Taiwan, because I think Taiwan is a perfect place, like I said, a testing ground, for research development and for manufacture. But I think Singapore is really the, an international city where you can really attract talents worldwide, where we actually need it now at that stage of our the company. And production, we're getting very mature in our production, and automation. So I think Singapore is also a great place. And I think last but not least, but I think testing, like masks, it's a matter of national security as well, and a vaccine as well. So I think it's important to go back to your home country and help the country to secure the country. So that's what we're doing here now. Yes.
That's really interesting. I'm a huge advocate, as you know, for international education and international students. And I've been known to say that they're very entrepreneurial. Both of you were international students at Imperial, and that you create more jobs than you consume by staying in the country. So our post-study work visa now in the UK, I hope, will help some of our students stay in the UK for a couple of years to get their feet on the ground or to get involved in one of these companies. But I would, it's something I think we need to continue to advocate for. And as you look at a global pandemic and crisis, you're helping the whole world, and we can't be isolated. There's having rapid tests in Charles de Gaulle and Changi airports is going to be important to all of our world economies going forward. And so it's very inspiring to hear your early stage stories, because you're still very young companies.
And I think especially important at to test at the military, where we had requests from many countries, and our machines actually deploy in German armies now as well. Yes.
Let me just ask you both to dream. You've been great visionaries. You already had your idea. You had plans. You knew also what concretely you could work on that was most important and would be something that there would be a market for. How do you look in the future, and how do you see this evolving after the pandemic? And what will get used to being tested? I suppose sometimes nasal swabs, sometimes saliva, sometimes blood. What do you see for the future?
Well, I think Pantelis said that pathogen doesn't exist just now. COVID is now, but we have pathogens, infectious disease from the past and most likely in the future as well. So testing is never ending. And as for now, I think testing is especially very, very important, because if we want to open up borders, because we want to protect our loved ones. And as for now, we clearly see that herd immunity seems to be out of the reach, as vaccination rate is more than 70% in many countries. So I think testing will be it's going to be a normal thing, and going to bring normal life back to our to us. And I think how to make it easy and affordable and really quick turnaround time is very, very, very important. So I think especially in borders, I really promote to governments that we should do pre-boarding testings and landing testings. And I believe that PCR is sensitive enough that especially the window period for Delta now is really, really short, that PCR should be sensitive enough to catch all the infected patients.
It would be great to get that streamlined and not have to be shipping kits around to labs, as you say. Pantelis, yes. Your view of the future?
So my view is, the vision is that diagnostics will be for all. We're already experiencing a decentralized approach to testing through the antigen tests, where you don't need to send off things to labs to get tested, incurring costs, labor, delay times. What the future is going to hold is having that sophisticated type of molecular test equivalent to the PCR at the point of care, but also easily accessible. I mean, we've already seen fantastic innovation in terms of distribution. And there's so many companies now, call them Amazon, Deliveroo, and so on and so forth, which within a few hours can get you a test to your door. So my view is, we'll have something in the home, for example, similar to your Nespresso machine, where you just order off Amazon what type of diagnostic test that you want, you put it in your machine, and it relieves you of any worries, because we've all been in that situation, especially during this pandemic, where we've woken up with a bit of a runny nose, a bit of a headache, and we said, "Oh my God, is it COVID?" Probably not. Could be hay fever. Could be something very simple. But the answer to that, has huge implications. Do I go to work? Do I not go to work? It unlocks economies. It also maintains people's well-being, because they don't have to self-isolate. So my vision is, we'll get there. We'll have all that sophistication of a lab on a tiny lab on a chip, and it will be deployed routinely on home. So, the world will have access to these sophisticated tests routinely and as easily, in a similar technological evolution to, the semiconductor industry, the mobile phones, all the consumer electronics. So that's the vision.
Yes, it is amazing when you mention the Nespresso machine, how rapidly our habits have changed over a period of time. If you think back to before Nespresso machines, and when you were young students, perhaps undergraduates, did you ever envision yourself doing something like this? And what would you say to students now? Because it seems the pace of change and the opportunities are growing, and it can be very exciting, but as Winston, as both of you point out, very hard work and a lot of uncertainty and a lot of challenges. But what would you say to a undergraduate? Think back to your young self, and how did you see the future?
When I was at Imperial more than 10 years ago, I never thought of being able to do this. So I think, but I did have a dream that time, and I think you have to dream big and pursue it and be persistent. I think I was very blessed because without the pandemic, pushing POCT, pushing point of care testing into market, it's very difficult. In the medical world, they don't like to move. Only when they encounter big catastrophe like this COVID-19, they will try to change. And COVID-19 actually leapfrogged point of care testing, especially molecular point of testing, at least 10 years. So I'm very fortunate and I'm very grateful. So my advice to the Imperial eager young mind is that I think dream to dream is perfectly okay, and please dream big, and if you're persistent and you work really hard, and your dream will come true.
Thank you. Pantelis?
That resonates really well because again, myself as an undergraduate electrical engineer, I was always a technology enthusiast. I loved realizing my imagination. I think that comes also because I was a big fan of science fiction. But then coming to the end of my degree, I said, okay, what can I do that's going to change the world? And working in healthcare technology, it gave me that avenue to apply what I'd learned in terms of engineering and technology into medicine. And that for me was very fulfilling and transformational. My advice to all the undergraduates is, there's never a bad idea. Always follow your dreams, always innovate. You've got the capacity and the capability and the tools, through your studies to realize, what you want to achieve, and think big. Don't think what's going to happen in the next 5 years' time. Think about 10, 20, 30 years. It's our duty, to innovate the future, not to just contribute to what's happening locally. And we're going to do that and make that change, by thinking forward, thinking big, and being passionate, carry our enthusiasm to realize what we're imagining and our ideas.
Well, thank you both. I think you've just helped me write my commemoration day speech to tell the graduates who will be in Royal Albert Hall again, which is very exciting, to dream big and to think ahead. I would just like to talk a few minutes about how Imperial is thinking big. And as you know, we have fantastic scientists in medicine and science and engineering and business, and we're bringing all these people together in our Institute of Infection, which couldn't be more timely. It was already something we were doing, but it's absolutely front and center now. And I think it's really important to think about how you get from that pivotal understanding of the virus itself, how it's working, the genetics, the way one can treat it with therapies, the way one can find it with detection, and the way one can prevent it with vaccines. And so we bring all that together, understand detecting, finding, treating, and preventing. And Pantelis, you're the faculty of engineering champion for the Institute. I'd love to have you say a few words of what you find there, because I think it's an important thing that Imperial is doing.
Yep. So I think that, throughout the pandemic, Imperial showed that it has a very broad range of expertise in infectious diseases, ranging from all the vaccine work with Robin Shattuck, the epidemiological work, all the diagnostics work. There's been many companies coming out of Imperial College. And what we identified is we can collectively bring it all together under one institute to form a critical mass, and then drive our mission and agenda in terms of infectious diseases. My role, obviously, being the Faculty of Engineering champion, is to facilitate technologies in the institute, help all the great technologies coming through Imperial go through that channel, because there's also lots of opportunities for collaboration and translation. And in addition to that, we can welcome you to our launch, which is in a few weeks' time. We've also got a seminar series, which I'll be giving a talk in 2 weeks. It's a 1 hour slot, so you can hear a bit more about the technology. So, we'd like to welcome you to our institute.
Yes, and I would cordially invite everyone to come to your talk to hear more detail about how your technology works. And perhaps Winston will be there to ask you some tough questions as your former lab mate. And also to the launch, which I think we can probably, I'll ask Amy to put into the chat so people can find it. I wonder if you have any closing thoughts, because I think that we are in a very pivotal time where we recognize testing is so critically important. And we need to capture this moment, I think, to prepare ourselves for the world going forward. I would just thank you both for your contributions, how you took what you were doing and pivoted immediately to dealing with this crisis under very hard and difficult circumstances, and have made advances that are really making a difference. And I wish you both well with your validation points. So any final comments?
I saw a last question, and I'll answer that quickly. So we are selling in UK. We have more than 500 machines in UK, and if you're interested, I can connect you to our distributor. So to back to the question, I think testing could be more critical to reopen our economy. You know, people are losing their jobs, and we want the world to go back to normal. But most importantly, that, you know, I want to end with a quote from chairman of the Institute of Merit, Alan Merritt. He said that without diagnostics, medicine is blind, which I find it true, you know, throughout my years of research and developing. And I hope that, you know, Vita PCR is our second platform, and we're going to roll out third platform, fourth platform, sampling result platform, and with different specimens, and also a protein platform to diagnose the heart attack in advance. So that is very exciting, and I hope that I can contribute to the world and work with Imperial as often as possible. I'm very happy, and I'm happy to help if you know, with my experiences. And thank you, President Gast, and I'm very, very grateful.
Well, thank you, and I wish you really great successes. There's still a lot of hard work ahead, but I know you'll shine. Pantelis,
thank you.
Comments?
So we've come of age now in diagnostics. I mean, the pandemic has not just educated the public in terms of the advantages of testing, it's also allowed acceleration and deployment, acceptability of testing. As Winston says, it could be crucial to unlocking our economies, but we also have to bear in mind the huge healthcare challenges and the burdens our hospitals have undergone. I mean, there's a huge backlog now of other illnesses and things which need to be treated. You know, people are waiting to get treatment. People need to be now triaged. That's another massive hurdle we're going to face now as we're unlocking our economies and going back to normality. So my hope is, you know, we're going to continue in this trajectory. You know, diagnostics can impact in healthcare, it can save lives, and we'll continue working, you know, around the clock to deploy them where they're most needed, so that we can, you know, improve people's well-being and improve our, you know, everybody's quality of life.
Thank you very much. You're both very inspiring alumni and colleagues and friends, and it's been a pleasure to talk to you. I hope you have great successes going forward. And as Amy has said, we will share details of the Institute of Infection launch in an email. It's in early October. So thank you.
Thank you.
Thank you, President Gast. Thank you. Thank you very much.
My pleasure.